Hey guys, and welcome back. And I'm back again, this time with my book, Quick Review in Clinical Periodontics. So, as promised, and I had told you that I will be discussing why I wrote this book and what can you find in this book, what is different from other textbooks. If you like this book, I'm going to provide a link for everyone. You can always purchase this book, it's available on Amazon, amazon.in, amazon.com. When we started, it was only sold in Southeast Asia, but now it's also available to be sold in US and the UK. And I wrote this book in 2017, and within 1 year we sold more than 100 books. I'm very happy. The foreword of this book was written by Dr. Fabro. I don't know if you guys know Dr. Fabro. Mostly people who are doing MDs would be knowing. He's a very famous researcher from the University of Milan. He's read the book. He gave me insights into how I should make it better when I was writing it. So I've taken the advice and have tried to summarize things that he had given me advice on. This book is, like you can see, it's a very small book. It's a handbook which you can carry anytime when you want to revise, when you want to see anything or check anything for yourself. It has like 187 pages, and if you can see the index, there are like 10 chapters, but this book does have 19 chapters. This book does not have implants discussed in this one. There's another book coming of mine that has that solely on implants. So this book is only on periodontal subjects, starting from gingiva and ending at lasers. Firstly, why did I even write this book? So as you know, I've done my periodontics residency, and when I was even doing BDS, I was always interested in reading. And most of you who are already doing dentistry, then you're final year or you're doing MDS, you would agree with me that it's very hard to find information in one book. Not what you find in Carranza is very different what you find from Linde. Linde is a research-based book. So if you want to find about authors, if you want to study theories, you have to go to Linde. And if you want to study about the clinical aspect of something or the latest anything, we have to go to Carranza. And if you want to know what exactly was said like ages back about perio, you'll have to go to Glickman. So it was very difficult, to carry heavy books all the time. And that was the whole intention why I even thought about writing a book. To concise all the matter. I've tried my best to concise the relevant matter, which you would find useful if it's your viva there, or if you have a clinical exam, and also you can use the same information when you are writing something. Also, whatever information I have taken from different books, I've mentioned the books. If you want to read more, you'll exactly know which book to look at, and you can find that information for more in-depth understanding. Again, I have to emphasize it's not a clinical, textbook. It's just a handbook. A handbook, something that you refer to for concise information. And along with concise information, I provided you sources where you can get exact information if you want to read more. So now coming to my salient features. So I've told you why I wrote this book. What would you find in this book? This book is something which you can say is a summary. How you write a particular chapter and how you summarize all the information is in this book. Let me show you here what I mean when I say that. So if I go to gingiva, you see there is something called as purple, something called as a note, and that's in purple. What are these purple blocks going to tell you is any clinically relevant thing that will be after that follows that topic. So in this particular thing, you find about mucogingival line. There's a lot of pictures in this book, and that's what my aim was, to make it as much understanding for everyone. If you're like me, I do not really understand by just reading. I need to see, to understand, to visualize, and that's how surgical subjects are. So I've really tried my best with my hand-drawn diagrams and with a lot of pictures for you to actually visualize what you are reading. Okay, there are lots of diagrams here. So other than the purple, you see something called as a brown, which says the clinical note. Now, clinical note I've written is the questions that you get in the viva. Like they would ask you, very commonly asked question on how would you identify a mucogingival junction. So there are three ways, like anatomically, functionally, histologically, and also then another is a latest. And when you read a big book, our usual mentality is that we just read it, and then when we have to find an answer, then we'll try to actually look in between the words and try to find an answer. So what actually I've done is I've taken those in between the lines answered and put them here for you, so you don't have to scroll the whole book and find the answer, but it's here under the clinical note. And that's what my purpose is for writing this book. Another thing that I've done is at the end of each page you will find something like author's note. So an author's note is to summarize what you found interesting in that particular topic, or what I found interesting and what I would want you to look at when you are working on a patient, or what I would recommend you to think about. Okay. Another thing that I've done is summarization of all the indices. Now, indices is a very common thing that a question is asked to you either theoretically or clinically, and you have to talk about it. Sometimes it's not easy to find all the indices, so I've put them all here. To the best of my ability, whatever indices I know are asked, I have put them here. Very latest indices also. So when you go to gingival recession topic, you will find all the latest classifications to 2010, and book keeps getting updated, so new bill additions will be coming related to it. Let me take you to another topic that I want to talk about is like periodontal pocket and periodontal abscess. What I like about is in gingival enlargements or any other topic is that I have put actually the questions that you will come across. They are mentioned in Carranza or Linde, but it's often difficult to summarize them. So again, I'm repeating the point that the point of writing the book was to summarize the concepts from different books, and which will make it easier for you when you have your viva. When you have a viva, rather than actually taking all the books together and trying to find all the information, you can just go to this handbook, keep it with you when you will walk into the exam hall. Just before it, you can scroll, look at any classification, look at any key point that you would want to mention in your exam, or before your viva. It would be very useful. And for your routine clinical practice, there's a lot of pictures. There's a lot of pictures that you would not find maybe somewhere, or you would find, but again, this is all concise in this particular book of mine. I've also tried to put extra information for students who are doing post-graduation. So let me show you the example here in page, yes. So if you see the bifurcation and the reconstructive periodontal surgery. So what I've done is that if there is any information that is actually relevant only to the postgraduates, I've put that here. As you can see on the screen, bone grafts is a very vast topic, so undergraduates would probably not find some information relevant for their exam, but for postgraduates certain things are. So I made a different column for that also. Wherever there is an in-depth knowledge needed for postgraduates, I've put that here, and you would probably find that useful. A lot of theories from different subjects, different topics, how the surgeries are literally done in our country. If you see one thing that is kind of different in Carranza or Linde is that those books were actually written keeping in mind that they will provide the academic information, but the surgeries that are mentioned, the instruments sometimes are mentioned, are not literally what we use in India. Maybe now we are getting those, but still in the academic system, in the academic setting, those techniques or instruments are not always used. So I try to put the pictures or the techniques, the same techniques, but I've also provided you a perspective of how they are performed in our setting. So you know what to expect and what are the different modifications you can do. Other than that, this book also has a lot of new topics about plastic surgery and lasers. Lasers is a new topic, so I've tried to only put the information that you would need just for your exam purposes. So if I have to summarize as to what are you going to get from this book, is that it's a very concise small book with all the concise information from different sources, and the sources have been mentioned also. You will find it useful when you have your exam, or even when you're just starting your periodontics class, the periodontics clinicals, and you want to understand the gist of any particular surgery or any particular topic, and you have your Viva exams also coming up. So it's um, it's basically a summarized book that I have written here for more understanding and for postgraduates also. So if you like it, I'm going to provide a link. You can always purchase the book. It's available on all the Amazon, like I said, Amazon, and even in the stores. And my next book will be coming up soon. That's on implants, and it will be completely on implants. Coming to what I'm going to talk about in my next video, since it's the interview session time, we have lots of interviews happening for DDS and for MS. I will be giving you certain tips on how to perform and how to answer in your interviews. So stay tuned and I'll see you again. Bye bye.